You might see some enhanced health screenings for the Ebola virus at certain airports. O'Hare and Midway are currently not among them.
But this comes as Air France flight from Paris to Detroit just last night had to be diverted from Montreal last night due to that American restrictions linked to the outbreak in Africa. And right now, new U.S. restrictions say anyone traveling from countries at the center of the Ebola outbreak will be required to fly into a specific airport. So far, the Democratic Republic of Congo and Uganda have reported over 500 suspected cases, 34 confirmed cases, and 134 deaths as well. And this Ebola outbreak has really quickly grown, putting world health leaders on high alert.
There are concerns and questions on how far it could spread and how long the outbreak might last. So joining us now for some expert insight is Dr. Alfredo Mena Lora, an infectious disease expert at Chicago's St. Anthony Hospital. Thanks for joining us, Doctor. I know the World Health Organization has declared the Ebola outbreak a public health emergency of international concern and expressed worry over its scale and speed. Is there potential for the virus to spread even wider, including to other continents?
There's certainly the potential, particularly in surrounding countries. Part of the reason why the cases have kind of ballooned over the past few weeks or so is because it has been caught a little bit later in its stage of progression, and there's probably more cases out there, and it's in a conflict-ridden area with porous borders, so it's very likely to spread to surrounding countries.
And we know the virus spread, it was undetected for weeks because initially health officials were actually testing for a more common type of Ebola, and so the results were coming up negative. So can you talk about how you think that might have slowed down the response and also led to the bigger outbreak that we're seeing now?
Exactly. I think with a delay in testing for a variety of reasons. First of all, this type of virus, the Bundibugyo virus, is different than the most common ones that we typically see, like the other Ebola virus from 10 years ago, where we also had an outbreak. So that affects our ability to diagnose, and also it is in a difficult to reach area that is conflict-ridden, which can also impact testing.
I know the other concern here is a lack of approved medicines and vaccines, and yesterday we learned a vaccine would not be available for at least 6 to 9 months. So how much worse do you see this outbreak potentially getting?
Well, we do believe that the outbreak will continue to grow in the number of cases, and there's still a lot of containment that needs to happen locally. This strain of the virus, this different virus, we do not have vaccines or treatments, but we do have a playbook. We have been dealing with these outbreaks of Ebola, and we know what to do.
And I know people at home might be wondering this. The CDC has implemented these screening procedures for people who traveled from the affected countries. We have Congo, Uganda, and South Sudan. So what do you think of these precautions that are put in place? Is this effective enough in maybe curbing the chances of it coming to the U.S.?
Definitely. This is a prudent precaution. However, it still requires a lot of local containment of the virus. Folks, for example, may have contact with this and be in other countries. So it is not a perfect method. And ideally, we have to go to the source and contain it there.
All right. Dr. Alfredo Mena Lora, thank you so much for joining us this morning. And please, let's keep in touch.
Thank you very much.